All right. Hello, everyone. Thank you to CED. Thank you to all of you. So my name is Vikram Setharaman, founder of PT Wired, the full-featured digital solution to the physical therapy industry. Around a year ago, I had a pretty bad hip injury and ended up having to have labral reconstruction surgery. And as I'm sure you can imagine, this process involved a lengthy, frustrating physical therapy process as well. And I was really motivated from the very beginning to get back to full activity and full health as quickly as possible. So I was a bit disillusioned when I was sent home after my clinic appointment with one of these, a piece of paper with exercises scribbled down and handed to me. And if any of you have done physical therapy, I'm sure you're very familiar with this. It's the norm. And I didn't feel engaged fully. I didn't feel like I had the instructions and resources I needed to really optimize my recovery. And me being of the generation that is addicted to their smartphones, it didn't take me long to think, why isn't this on my phone? Why don't I have an app with videos and notes, reminders to really guide me through this whole process so I can really optimize my recovery? And from this idea, PT Wired was born. It was an idea of moving prescriptions into the digital age. But as we actually talked to physical therapists and realized what their workflow is like, we understood that we couldn't just introduce a product like this that adds steps to their workflow. PTs have 2 to 3 hours of documentation a day. We wanted to be able to reduce that amount of work rather than add to it. And in addition, we need to be able to integrate and interact seamlessly with electronic medical record systems. So once we had a good understanding of this, we set out to build PT Wired as a software platform that would engage all patients involved and move physical therapy into the digital age as a whole. During a patient's first in-clinic appointment, they will have a physical therapist with a tablet device or a small laptop. The physical therapist will customize that patient's specific at-home exercise routine with them in the clinic. And meanwhile, all of this information is automatically stored, analyzed, and summarized by the application and inputted automatically into the electronic medical record. This means that they don't have to do any work multiple times. It's all done once. When the patient is at home, they'll get a push notification on their mobile device that says it's time to do their exercises. They'll go through step by step, guided by an instructional video, notes. The app will actually count and track reps for you through the speaker, and it makes the entire process much more interactive and engaging. Once you finish the exercise routine, you'll then be prompted as a patient to do an outcome report. This could be a research-based PRO or just a general questionnaire of, how are you doing? What's your pain level like? Is there anything you want to tell your PT or ask? Once this information is collected and inputted into the app, it will be, again, analyzed and stored, sent to the PT so they can keep track of you the entire way, and then inputted into the electronic medical record. This means that the subjective portion of the documentation note is completely automated, and the PT won't have to touch it. So for physical therapists' benefits, there's better patient engagement, reduced documentation workload, trying to cut into that 2 to 3 hours a day of documentation that they do. And then, of course, improved patient outcomes. If patients are actually engaged and adherent to their rehab, they'll have better outcomes. For patients, better instructions and engagements will lead to better outcomes. And then, of course, with better outcomes, they'll be more satisfied with their care. Clinic owners will also benefit. They'll see increased revenue through efficiency in their clinics. With physical therapists spending less time on documentation, they may be able to see more patients in a normal day. And then, in addition, there'll be more referrals to that clinic through the better patient outcomes. This can be through insurance companies or just other patients. And finally, for the clinics on the new bundled payment models and outcome-based care, they'll see a big increase in revenues because they can actually hold patients accountable now for their care and speed up recoveries. So we've already done one pilot test of PT Wired at UNC Sports Medicine. We had an adherence rating of 70%, which is a doubling of the industry norm, which is only 30 to 35. Currently, we're operating in Dan Ariely's Startup Lab Accelerator at Duke. We're working with them on a collaborative research study to incorporate behavioral elements into our app. We're trying to see which features we can add to really have the most possible impact on patient adherence. And we're also in discussions with 2 PT organizations for pilot test trials. Since we had to submit these slides, we've actually finalized one of them. And we're looking to add 3 more for this phase. After we complete the pilot test here, where we'll be getting metrics on adherence, outcomes, and physical therapist workload, we plan to raise more funding. So PT Wired was founded by myself and Mehek Shah. We are two former UNC students who have gone through extensive physical therapy as a result of being injured a lot. And we've surrounded ourselves with physical therapy expertise, orthopedic expertise, startup and technical expertise, and of course, behavioral economics expertise with Dan Ariely. So thank you very much. Please come talk to us if you have any questions or comments. As I mentioned, we're looking to add 3 PT groups to the trial. We would love any introductions or referrals, and we're also looking to build relationships as we plan to fundraise after the completion of our next pilot test. Thank you very much.